And we are live.
Thank you, Jericho. Since we have a quorum, the first thing I'm going to do first call the meeting to order officially, and then I'll have a roll call. So please say yes or here when I call your name. Allison Forsgren.
Yes.
Diane Flaherty. I see you are here, Diane. Vanessa Larrabee, I know she can't make the meeting. Kendra Lockley. Absent. Judith Perkins.
Here.
Susie Spring.
She was here. She was trying to get in. I don't know what happened to her.
Okay. Linda Williams
Here.
and Mary Ann Easley and myself here.
Excuse me, I'm here, Diane. I just was able to get in.
Thank you so much.
And I just admitted Susie. You might want to repeat that one real quick.
Okay, Susie, could you reply that you're here?
You're on mute, Susie.
Can anybody hear me?
I
Yes.
can hear you, Diane.
I just got the voice, so I don't know who's here and who isn't.
I'm here. Mary Ann's here. Allison is here. Judith is here. Susie's here.
Susie's here. We definitely have a quorum.
So we have 6 members here.
Yeah.
And we have guests. We have guests. We have Joe Aguirre. Laura Stewart's here. I
And
believe
Nancy
that's
Swain
Nancy
is here.
Swain. Yeah, Nancy Swain is here.
Right. Okay, the first thing I have to do is read this script for remotely conducted open meetings. As a preliminary matter, this is Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me, and I've already done a roll call of members. So I'll call on staff next. Jericho Mealy,
Present.
Laura Stewart.
Present.
Okay, we do not have any anticipated speakers today, although we do have guests, Joe Aguirre and Nancy Swain. Good afternoon, everybody. This open meeting of the Council on Aging is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda. A couple of ground rules before we get going. Please remember to mute your computer or phone when you are not speaking. And please remember to speak clearly and in a way that helps generate accurate minutes. It is also best for each person to identify yourself before speaking so that our secretary can know who is speaking at the time. Thank you. So with that, I'm going to go back to the agenda. And the first thing on our agenda is approval of our minutes from our last meeting, which was January 6, 2021. Everyone should have received those minutes. So,
So moved.
Second, Susie.
okay, thank you. So the
You have to
minutes.
do a ro-
the
You have to do a
minutes-
roll call on that one too.
Okay. So this is for approval of the minutes. Please respond yes or no. Allison,
Yes.
Diane,
Yes,
Judith,
Yes.
Susie,
Yes.
Linda,
Yes,
Mary Ann, yes. Okay. The next thing on our agenda is an opportunity for public comment. And Nancy Swain has joined us today because she would like to comment. So Nancy, I'm going to turn this over to you.
Yeah, we appear to have lost Nancy.
I see her there.
he's still here.
Nancy, can you hear me?
Tell her to unmute. She may be on mute.
No, she's not on mute. She's just not on, it's dormant. Her
Well, there's 10
connection's dormant.
participants.
Yep, she's dormant. She doesn't have a mute button here.
Oh, there
Yeah,
she
she's
is.
unmuted. Okay, there we
She's
should,
back.
that should be it.
Nancy, are you ready? I think you're on mute.
Her sound must not be on because she's not on mute. Her little red microphone's not in the corner.
Yeah, what she's probably done is you probably have not used computer audio, Nancy. When it asked you if you wanted to use the computer audio, you should have used the computer audio.
Bottom left, tell her.
Nancy, what I'm going to do is I'm going to move you back to the waiting room and then let you back in. And then it should ask you if you want to join with computer audio. That's the
Say
one you want to hit.
yes.
All right, give that another try, Nancy.
Okay, can you hear me now?
Yep.
I didn't mean to blow you away here. Thank you for letting me join you. The reason that I'm asking to be here today is I am wondering if NCOA has given any sort of a decision as to Senior of the Year. I know that you didn't do it for 2021, but I would like to see that kind of resumed, and you could do it on a Zoom basis as well. Just to give you an idea, I lost 2 of my class members last year that were, one was in their 80s, one was in their 90s, both of which I think had been named Senior of the Year. But as time progresses, we're losing these people little by little. And I think to let that event go would do the community as well as the recipients a disservice. So I'm wondering if you could put any thought into resuming the Senior of the Year. I know you can't do the fairgrounds meal or things along those lines, but you could have a Zoom festivity, inviting their friends, their family, everybody to join in and at least give them the award. This usually doesn't happen till the very end of June, but I think it would be a nice service to resume that if you could.
Can I ask members of the council if you have some comment on this?
I'm all in favor. I think it's a great idea. The criteria is probably, we're going to have to do a little more digging on the criteria only because people aren't as active and they're not out there. They're not at the salt marsh. They're not volunteering at the hospital. We'll have to figure out, who's been able to persevere in their public activities during this time. So that we'll have to do a little more research on that one, but I'm all in favor of it.
Are there any other comments from any other members?
I'm in favor of it too. I think we have the application form that we can send out electronically, but we will have to take a look at the questions and maybe have them. It's the criteria for becoming the Senior of the Year that might have to be a little different. Does anyone have any ideas on that?
Well, we
Could you
might-
Can I
possibly-
comment on that? This is Joe Aguirre. Can I comment on that?
Yes, please.
If you recall, I think about when this started, I had recommended that you do that anyway for this year. Because I thought it would be something that could be ongoing and it could be done virtually. and you could give the person a dinner or whatever instead of having the group at the luncheon at Fairgrounds. And I received a letter, which I appreciate, stating that it wasn't going to be done. There are a lot of people out there that are doing a tremendous amount of work. And I think Laura would have contact with some of them who are doing this. These are volunteers. They're not like myself who are paid to do virtual programs. And I think you ought to look at the criteria and maybe expand that a little. And also contact people around who are dealing with like the learning programs that are on, the cooking programs are on, and so forth and so on, and see what people are doing. A lot of the seniors are involved in volunteer work in terms of providing meals, getting meals to people and so forth. There's got to be a wealth of people out there who are doing outstanding things. Even if you just gave it to, if you expand your criteria and gave it to all the nurses and doctors who have been through this particular pandemic. I mean, do whatever you wish, but I think it should be continued. I was opposed to breaking it, even though I understand the consequences, but I think it really should be strongly considered to do it again. And
You
for
also have
this,
all those-
as soon as can.
You also have all those guys that are, I agree with Joe. Sherry's got a whole raft of people over there doing Meals on Wheels. She has had no problem getting volunteers for Meals on Wheels. And so I guess there are whole groups out there that are keep going.
Would one of the council members like to make a motion so that we can further explore it and then maybe vote?
I'll make that motion that we continue to explore it and maybe readjust the criteria.
Allison, second.
Any other comments from council members? Okay, thank you, Nancy and Joe. Looks like we're going to go ahead and explore this for 2021 and probably get the whole thing moving along again.
We have to take a roll call vote.
Well, thank you, Linda, for your reminder.
I do 5 or 6 of these crazy Zooms a week.
Okay, a vote, yes or no. Allison,
Yes.
Diane,
Yes.
Jude,
Yes. Susie.
She's on a phone call.
Linda,
Yes.
Marianne, yes. Okay. I'd like to ask if there's a member who would like to take the lead on this, because it does mean cranking up a lot of, there's work to do to just get it even going again.
I don't mind working on it if Allison wants to work with me.
Sure.
Because I'll get a hold of Sherry and I'll get a hold of some of the other groups that are still going.
Well, I think
I would help as well if you need. if
that,
you
I mean,
need
you know, what
Whatever you
what
need.
needs to be done is we need to get the nomination papers out, because
Yeah.
that's the only way we're going to get people to be voted on, is if we get people to be nominated. So however, you know, I think people might be, it might be easier having been so computerized the last several months. But it will be a challenge. I think many of the applications we've gotten in the past have been written by hand. So we're going to have to change that criteria too. But I'll send out to, I'll send to Laura last year's questionnaire,
Yeah,
and she can send it out to everybody.
because we may have to change that and make, put a line in there about somebody who has persevered over the past year, something like that.
Okay.
Yeah, and this is Marianne. I think there are a lot of details to be worked out even before it's launched, because it's going to require publicity to people who may not even have access to a computer and now don't even come into the salt marsh. So
Yeah.
a lot of details and a lot of new ways of looking at things. So
But
thank
people-
you.
People other than seniors can nominate those. So,
Yep.
you know, we might be able to put it on Nantucket community, you know, some Facebook group
I
as
am-
well.
I am absolutely happy to task Island Social Media to do any kind of publicity that we need on this. And I also can probably host some way to collect votes, or however you guys want to do. If there's like a poll or something you want to do, we can use some town resources to help get numbers and names and that sort of thing.
The COA votes on it, but the submissions can come in any number of ways. Maybe there's a box outside, they can drop them off if they want to do it by hand. There's any number of ways of doing it. Not everybody can do it by email, but then we can put it on Daybreak, which comes out every day from Bill Farrell. There's any number of ways of getting it out there.
Thank you, Linda and Allison. And Diane, did I hear you also wanted to be part of this?
Yes, I would help. I have not done it before because we didn't do it. I wasn't part of it last year, so I'd like to learn. Sure.
So the three of you can work on this together, and I hope that by the next meeting, the March meeting, we can start to look at this seriously, launching the whole thing.
Cool.
Thank you so much, board, for hearing me out. I look forward to working with you folks on this in the future.
Nancy, before you go, Madam Chairman, if I could ask her through you, Nancy, are you still doing your exercise thing, but online?
I am Zooming Monday, Wednesday, and Friday through the Salt Marsh Center.
How many people do you think you have at each one of those?
Oh, gosh, I'm thinking probably Laura would know better, but maybe 12, sometimes 10 or 12.
That's great.
Which is good, yeah. And it keeps everybody busy and they socialize. So it's a wonderful social event as well as an exercising event
great.
for everybody. Yep.
That's great.
May I answer Linda's question as well?
Go ahead, Joe.
Virtually all the people that the town employs to be fitness instructors, and I think all of them are actually doing the work.
That's
So
great.
everyone's doing it virtually. So the programs such as Kettlebell, Nancy's programs, and other programs such as that are still continuing. Once they started, they're still on an ongoing basis every week. And, they're reaching people who really want to jump on and so forth. For Kettlebell, I have a maximum of 4, but other groups have either the same or a little larger groups as well.
That's fantastic, because you got to keep moving.
Absolutely.
Thank you very much, Nancy. Appreciate your suggestion.
Thank you so much for the board too. Take care.
Okay. Okay, I'll move on to the next thing on the agenda, which is a report from Jericho, who covers the whole waterfront.
So I think the agenda phrases it as was it a COVID and Task Force Human Services update. So I'm going to cover very briefly the enforcement side of things. I'm going to mention a couple of things that other human services providers are doing in this field to do economic amelioration for any kind of COVID related stuff. And then I'm going to briefly give a overview of the vaccine process, where we are and what people can expect from that coming forward. So basically on the enforcement front, we're mostly doing job sites. We're doing some general patrols, and we're trying to make sure that we pair education with outreach as best that we can. That's more or less it for enforcement until we get everything set up around March for the return of the landscaping crews, and that's going to be the next challenge on enforcement. In terms of human services in general and in COVID directly, the Brookmore and a number of nonprofit providers, all established nonprofits on the island, have put together a kind of economic support group. It's a resource management group and a one-point entry for all of the the nonprofits on the island. So basically it's a single number for anyone to call for any set of problems that they have that's managed through the Family Resource Center, which then can connect and manage the cases of anyone who has any problems that that they're looking for help for among the Nantucket nonprofits. It's originally being rolled out as a COVID response, so that people who get tests or people who have to quarantine or people who are missing work due to COVID related issues will be able to receive, be connected directly to, the food pantry, rent or utilities assistance, behavioral health, any sort of thing. It's being run through the Family Resource Center, but it is open for everyone. It's not a family targeted endeavor. There are flyers for those going around. They're going out with everyone who takes a COVID test, and they're being distributed distributed physically in a variety of different stores in different places where there are likely people who may be suffering from COVID-related economic distress. And that's going pretty well right now, and it should be going full speed ahead from this week onward. So that is definitely a big human service development. The idea behind that is that further on into the future, this particular intake method is going to be kind of a universal number for anyone who needs help on the island to call, and that they will be then, their case will be managed by a single individual. They'll be sent to whatever existing, to Fairwinds, to Gosnolds, to Pascon, to whatever is the relevant agency, and that it gets all of the agencies communicating and collaborating so that there isn't too much duplication of efforts. Obviously, that's going to be a post-COVID development, but I'm very happy that the emergency framework they threw together as part of this economic amelioration task force, not task force, group. There's too many task forces, but this economic amelioration group is an excellent framework that can be then moved into kind of a permanent, full-time, Nantucket Human Services umbrella, so that everyone from seniors to students to everyone who's affected by it will get linguistically appropriate and properly maintained and communicative care for any problems they have on the island. So I'm pretty excited about that as a post-COVID development. Now on the vaccine front, basically the town and the hospital together are moving into kind of a full-scale vaccination effort. The first needles went in arms this morning as part of that mass vaccination clinic. This is the one that you've probably heard the most about. It's happening out at the VFW right now. The town has collected names of people who meet the various criteria, and then we pass that information out to the hospital to do scheduling, and then the scheduling outreach then sets up a time and an appointment for you, and then you go out to the VFW to get vaccinated. Currently, the hospital is only allowed to do on-site, quote unquote, vaccinations, which means only at the VFW or only at the hospital, given the large number of homebound people on the island, in coordination with Sherry Hunt at Elder Services, with the Generation Safe Nantucket Fire Department, as well as the Salt Marshes resources on this topic. We've put together a list of potential homebound seniors who qualify for the 75 and up category. And tomorrow we're going to do our first on-site vaccination with what we're calling internally the Vax Wagon. So we're going to go and get the homestead completely vaccinated staff and residents tomorrow. And then from next week on, we're going to be going kind of point to point to any homebound individual who needs vaccine that we're aware of, and then getting them vaccinated as quickly and efficiently as we can. So right now we're at phase 2 and step 2. Phase 2, step 1 of the Massachusetts vaccination plan. That's everyone 75 and older. That, assuming there are no major issues, we should have sufficient vaccine and vaccinators on hand to have that done inside of a week, maybe a week and a half, given the numbers that we have right now. From then on, we'll be moving into the 65 plus and 2 comorbidities phase. That should begin being scheduled next. It should be, assuming we get the go-ahead on the state level to move to 2-2, phase 2, step 2, to move to 2-2. We can, as soon as we get receive shipment of vaccine, we can begin doing that essentially immediately as soon as we get the go-ahead from state and we receive vaccine. Basically, at that point, we're going to be prioritizing people who are both 65 and up and have 2 comorbidities. Once we finish that subcategory, we're going to start with a mixture of people with 2 comorbidities and people who are 65 and up. We'll be taking an even number of both of those once we sort for a variety of different need basis. So that should begin in about 2 weeks and should complete first doses the following week after that. So two should be finished ideally, assuming no interruptions in the vaccine supply at the end of February, with then moving on to end of February, so the 3rd or 4th week of February, and then we'll be moving on to 2-3, which is the vocational ones, teachers, et cetera, et cetera. So we're going to continue doing kind of a homebound check so that we can backstop the Cottage Hospital's efforts. And then we can also be a little bit more flexible in terms of where we go, who we vaccinate. And so that should be basically kind of the masses of vaccination will happen at VFW. And then we'll have this kind of traveling vaccine wagon that we go to do on-site vaccinations. And that, I believe, is the state of play, as it were, in vaccination on Nantucket. Basically, oh yes, please go ahead, Judith.
Okay, my question is, when I signed up for the vaccine, it said, will you let somebody look at my hospital records?
So
I
what
wrote
the
that and get an answer, but so who's viewing my hospital records?
the hospital. That's it.
Okay, so it's not
So basically
town
what
or the police.
No. So I'm going to do a brief process section now because there are a lot of complexities here. But basically, there is the town is storing all of the responses to the town survey that when you went to the town site and you signed up and then you put all your information in, it sent you that confirmation email. It asked you to consent to share the information. That just means that it lets us pass your name, your date of birth, and your phone number, and that's your contact method, and that's it. That lets us pass that information to the hospital without having to worry about HIPAA violations. There's no actual medical data being transferred. It was a state of, a legal term that town council advised us town council in accordance with state council advised us to add into it. There are 2 people who can look at the results that you've sent in, and it's me and Roberto. Those never leave site. They don't go anywhere else. They're batched and they're sent securely with all of the medical data removed from them, and they go to the hospital so the hospital can set up scheduling. The hospital was issued a directive by MGB, by the greater, what was also called partners.org, that umbrella organization of hospitals. They were issued a directive to stand up a mass vaccination clinic on February 1st, which is where the difference between the town sign-up sheet and then having to interact with the hospital. So the way that it was structured, because we had bad feedback from other municipalities during the early part of phase 1, the hospital will only receive information it needs to do scheduling. And the only software that they have that can do that is their in-house medical records management software. So we have to run everything through there. And we can't just dump your guys' forms directly into the hospital medical system, which is why we had to do this kind of 2-step dance process. The decision was made that we could get more people vaccinated quicker if we go all in with the hospital and then work out site-based stuff for anyone that the hospital can't handle. The town's going to continue its parallel kind of vaccination process for the people that are missed by the hospital or are not legally able to receive a vaccine through the hospital system, either because they can't make it to the vaccination site or because they don't want to go through the hospital's records system. So basically, when you guys sign up on the town site and you get that confirmation email, we take those numbers, we make our allotment, we use that information to make our allotment from the state to figure out how much vaccine we can expect to get and how much vaccine we need to give out within a given period of time. And then we pass that information off to the hospital, and then the hospital reaches out and schedules people. I know there has been a lot of confusion on this, so I'll just take about 15 or 20 seconds on this point to let you guys know. If there's scheduling issues if you're getting to the point where you have a date and a time for your shot, then you're dealing with the hospital. If you're making sure you're on the list to be called, that's the town. And that confusion was, unfortunately, we just couldn't get that we couldn't mesh those two systems legally and safely in a way that would let us get people vaccinated quickly. So
How do you
now,
find out if you're on the list? I've had a lot of friends have a problem with this.
so if they have submitted their information
Yeah.
on the town website and they did not receive a confirmation email, or if they're worried they put their information in incorrectly, they can resubmit. What happens is because of the sensitive nature of the data there, we made it intentionally difficult to get access to. But we also we also built in an error correction system where it finds the most recent application that someone has. And because this list is batched and sent out to the hospital on a daily basis, if you re-enter your information, you do not lose any place in line. Your priority is determined on the day of transmission of the list to the hospital. So you do not need to worry about if you reapply and then get a confirmation email that you've lost a place in line. Same thing if you have more comorbidities than you put on, or if you're not sure if you put the most important ones on there, or if you don't know if you got their phone number right, you can simply reapply out onto the town site, and then we can pull any of the duplicates out and only keep the most recent one of your applications while we keep your spot, quote unquote, in line.
Can I ask 2 questions, please?
Of course.
The first is, you mentioned there was some confusion. One, going on patient portal and getting on and getting an appointment. This is a personal thing. I received at least 4 robocalls and 1 personal call from Mass General asking me to register when I had already registered and already received the confirmation. Is that the problem you were talking about? Because if I received that, I had that. Maybe others are getting the same.
Yeah. So the early on in the scheduling process, Nantucket Cottage Hospital and the greater MGB organization were at a bit of conflict in that everywhere else there are other healthcare providers, but Nantucket Cottage Hospital is the only healthcare provider on the island.
Right.
So they had to disentangle the automated calls that would go out. As of right now, I think if Gateway is how they're trying to get in touch with you. If they don't get in touch with you on Gateway, they have set up a call center where people will call you individually to get anyone who doesn't have a computer, doesn't have a smartphone, doesn't have a Gateway account. So that shouldn't be happening as much anymore. If it's any issue or question with scheduling, the hospital, there's a line on the hospital's webpage and homepage that that connects everybody to the appropriate number to make sure your scheduling is in. But if you're contacting the if you're contacting the health department, I can't change the scheduling. I can't get access to any of their computer networks. If anyone calls in health department or Saltmarsh has also taken a really very important and incredibly helpful step of doing a lot of communications for us. The Saltmarsh can connect you to the correct person at the hospital. They have the number there in that one pager I gave Laura. And then they also have, they've filled a bunch of these things out. They're as on top of the Gateway side of things as I am, I think, just from practical experience. So that crossover shouldn't be as big a problem. You had another one? Yeah,
the second question is, which vaccine are we receiving?
Yeah, that was my question.
Whatever they give us.
Okay.
anything that is FDA approved that is delivered, we're going to take.
That's great.
I know there are concerns about how the testing process for Pfizer, but this is a national emergency. They're as safe as they can medically be made, and we simply do not have the surplus capacity to allow people choice of maker or whatnot. The one thing, they will let you know when you're getting your vaccination which one is which. The other way to know is that I believe it's Pfizer is a 21-day window between the 2 shots, whereas Moderna is 28. So when you get your first dose, they're going to sign you back up for your next scheduled appointment.
Well, that's great. That's good to know.
Yeah,
that's excellent.
I have a technical question. I hear that the vaccines are going out to pharmacies, whatever. What happened to the fact that they had to be in this extreme cold storage? Is that
so
anymore?
So there are the two types of vaccine are Pfizer and Moderna. Pfizer requires the deep freezer. And that's the one they can do shipping. It can be out of the freezer for up to 6 days, but it needs to be used inside of that 6 days. And then when it's brought up to like administering temperature, it can only be out for 6 hours. So what they're doing is that they're shipping the Pfizer to anyone who has a deep freezer, so they don't have to worry about wastage, and they're shipping Moderna to everybody else. But because those deep freezers are very rare and temperamental, then they are going through more Moderna than they are Pfizer. So the deep freezer situation, what they do is they will ship it in dry ice packed cooler. Then it goes directly into a regular freezer, which means it has 6 days worth of lifetime. It all has to be used up within 6 days. And then as soon as it's taken out of that regular freezer and put in a normal fridge, it has to be all done and all injected within 6 hours. There are the deep freezer issue combined with the limited amount of time it's available, combined with the limited amount of time it can be stored at normal freezer temperatures, means Pfizer is a lot harder to use responsibly, whereas Moderna can be used just about anywhere.
What are we having? What do we get?
A mixture. We're getting anything that they give us, literally anything that they give us.
And this Johnson & Johnson, just out of curiosity, says it's about 60%. What is Pfizer and Moderna?
Pfizer and Moderna are 99 and 97% after the second dose, and they're both around between 54 and 58% after the first dose. So Johnson & Johnson is a single dose that gives you only slightly better
Than the first
protection
shot.
than the first shot of the other two vaccines.
So let's not get any of that.
Yeah, hasn't been approved for use yet, and I'm reasonably sure that the Johnson & Johnson one is going to go, like they're incorporating variant boosters into it, which is probably one of the reasons why it's not as effective right now. But there is a time pressure between getting enough people vaccinated with second doses and the prevalence of the various variants that are coming in from a variety of different places. The UK variant, the Brazil variant, the E484K variants. There's a lot going on here, and the importance is to get as much vaccine in as many people as possible before those new variants catch hold, which is why we're kind of the give us whatever vaccine works, and we can't give anyone choices on that not until far later in this process.
My understanding is the hospital bought one of those deep freezers.
Yeah, I know we are receiving Pfizer doses as part of our allotment, but the supply chain for vaccine from manufacturer is still a little wobbly. Moderna is attempting to double their output, and unfortunately there were kind of federal level issues in terms of hi Simon, how you doing, buddy? That's my other roommate there.
What is it? The cat?
Yeah, the cat Simon. He's a good kitty. He's being very photogenic right now. But basically, the approach here is to get targeted vaccine into as many people as possible, is starting at the high risk candidates, the age, comorbidities, and then getting to occupational categories that need to be protected in order to maintain regular operations of daily life. So right now, we can do the model that we put together for running the vaccination clinics. We can do 1,400 people a week, every week from now until the end of time. We'll never get, we're not looking to get, we're getting like 600 doses at a time or 1,000 doses at a time tops for 2 weeks. So once the vaccine supply stabilizes, we should be able to churn through a good portion of the island's population very quickly. It's just waiting on vaccine availability, making sure everyone's signed up, making sure everyone's aware of what they need to do.
Here's a question
So
for
that's
you.
an excellent report.
What
Thank
about town employees like the building department? We just had our third wave, and they deal with the public all the time, unlike the ones in the town building and unlike a lot of the other town offices. What about prioritizing the inspectors and everybody else at the building department? We're sick of going through this. It's the third time we've had to go get tested, those of us who go in and out of there.
Oh yeah, no, I have many in my COVID enforcement, with my COVID enforcement hat on. I have a lot of opinions about the planning department, but in this particular context, I'm going to talk with them about their COVID prevention protocols. But they are they are the next category of people who are going to get vaccinated.
Well, frankly, I think they should be before anybody else, because the inspectors have to go everywhere.
I have a great deal of sympathy with that particular point of view, but the guidelines of who gets vaccinated when are established by CDC.
It's not up to you, so we can move on. We can move
But-
on.
They
basically-
were ruled by the governor as essential service, and I just want to.
Oh yeah, but they're still in 2-3. That's with all the other essential workers. The trouble is if we try and move ahead on our own, we lose our vaccine allotment. It's already happened to municipalities in the state. It's already happened to municipalities in other states. So we simply cannot move forward until the governor gives us the go ahead. We can't go to 2-2 until we could have every 75+ person vaccinated on this island, but we can't move on to the 65-year-olds because we would lose future allotments of vaccine. So
When do you think the 65 and olders are going to be happening here?
I hope. Yeah, I mean, I hope in the next week or two. I've been sitting in on a lot of state calls and state webinars. We've got sufficient vaccine to get the 75-year-olds done, 75+ done over the course of this next week. Our next round of allotments will determine how quickly we go through 65+ and 2 comorbidities. Once we get through that category, we go through the 65+ and what's the word I'm looking for? Or 2 comorbidities. Apologies, there's a couple of things happening at once in the background here. But basically, the whole process is designed
81 oranges.
out of our hands in terms of when a lot of the timing goes.
Here's one stupid question for somebody in that office. The person's only 45, but she has breast cancer. And because of this last go round at the building department, they canceled her radiation until we all tested negative today. She doesn't have 2 comorbidities, but she's got one, which is requiring her to go to the Cape to get radiation every freaking day for a month, but she doesn't have 2 comorbidities.
Yeah.
How does she get it? They're not even going to do it if she's exposed.
She'll be in phase 3. We're trying to get 330 million people to do 2 things a month apart. There are going to be horrendous oversights everywhere. I'm going to do everything that I possibly can to make sure that I get, and the moral calculus on this is extremely clear. We need to get as many people vaccinated as quickly and efficiently as we can. There are going to be people cutting in line. There's going to be people doing all kinds of crappy things. The thing that we have to worry about is spending more time trying to make sure that only the right people get the vaccine than we do getting everybody the vaccine. And if the decision has to be between a system that is effective and efficient and is working, that tramples on as few people as we possibly can and has as few injustices as we possibly can, the moral calculus is we can't spend more time figuring out who gets the vaccine than giving people the vaccine.
And we just got people with life-threatening illnesses that need to be treated. And
Linda,
that's
I
the
just like to
problem.
suggest that if there are individual situations, that person is going to have to take it up with the health department or the hospital.
And Linda, so with the caveat that there's very little I can actually do on this, please send me an email describing the situation and I'll see what I can do. I really am trying to do as much of that as I can, but I cannot change someone from one phase to another. Okay. It would be more than my job. It would be the vaccine allotment that we get as an island. So everybody's vaccine would be impacted by phase jumping like that. And I am really heartbreakingly aware of a lot of edge cases that the system does not cover correctly on a daily basis. But the ethics of this whole thing is that it just has to be done. And we cannot spend more time making sure that the right people are getting it than we do making sure that it gets to people.
Thank you for the update, and let's move on. Thank you, though.
Jericho, that was fabulous.
Yes, indeed.
You could go on the road with Dr. Fauci.
Yes, indeed.
I do not.
Like our personal Dr. Fauci here on
I do not. First off, I am not a doctor. And
play one
I
on
do not
Zoom.
want his job. I do not want his job at all.
Yeah, but
Thank,
look
thank
what
you,
you're doing.
Jericho.
That's
And you're
My
great.
just as
pleasure.
good at explaining it, so thank you so much.
No problem. At any point, if anyone has any vaccine related questions, I'm gonna kind of throw Laura under the bus a little bit. The Saltmarsh can answer questions. Any questions that they can't, go to me, and then I can find the answer for them if such an answer exists.
Thank you. That was wonderful. And Laura's name having been brought up, Laura, you're next up on the agenda.
I don't know how to
Going
follow
on
up
for
after that. But with Jericho, we have been fielding lots of phone calls and helping people fill out the form if they are not computer savvy or don't have a computer or a cell phone, etc. So we've been doing a lot of that in the past couple of weeks. So it's always good to help people, and people just keep calling and we keep answering their questions, and Jericho's great at answering mine. So that's what we're busy doing in the afternoons, other than all of that Zooming that we do in the morning, which is great. We have been, we started a Saltmarsh Supper in collaboration with the NCEA, CFAN, and Nantucket Catering Company. So we did 67 dinners last Thursday, and they drive through. We hand them their dinner. We get to see everybody. We get to chat with people. It was on Daybreak, so we got a couple of people that aren't members of the Saltmarsh, but are seniors on Nantucket. So that's great to be able to reach other people that I don't reach in our newsletter. So that's fabulous. So if you know of anybody, have them give us a call. We still have, we have an allotment of about 100 dinners. And so we did 67. So we still have plenty more that the catering company can handle. And we'll see if Ginny and I can handle that as a drive-through. But it all went very smoothly. It was great. We also do have 2 Samsung tablets that we got through a grant that Jericho helped us get through IT. So there's 2. They both have data that goes with them. So again, if you know of anybody that does not have access and would like access, get in touch with me, because it's hard to reach them through the newsletter or social media if they don't have the device to get it. So spread the word.
Laura, I know that the library also has a number of
They do.
tablets. So they, they might, I don't know if those all go out all the time, but they might have seniors that are more in touch with the library than the Saltmarsh.
Right. I've actually talked with Ann Scott
good.
about that. Yeah. And I'm advertising the library information in the newsletter also, because they're actually PCs and not a tablet. So sometimes that's a little easier for seniors because it has a keyboard. And she said she didn't really know. She's not in charge of how often they go out, but we do have one senior that took one out and she loves it. And they can take them out as long as nobody else is in line and keep it, they can just keep renewing. So both options are great.
That's wonderful.
It is. Anybody have any questions about anything that we're doing?
I haven't gotten my application back in yet, but I'm going to.
All right, we're here. Get ready to exercise or come pick up a meal.
Laura, thank you so much. The Saltmarsh is really staying so active, and that's wonderful to hear about. Thanks to you and to Ginny. Great job.
Yeah, thank you.
Allison, can we hear from you about whatever is going on with Elder Services of Cape Cod and the Islands?
Sure. They meet the second to the last Tuesday of every month. So my meeting with them was just last week. They talked a lot about COVID and the difference. I mean, the differences between how we're getting it here and how they're getting it on the Cape are it's just unbelievably different. They can go to pharmacies. They're still having a lot of the same problems with the sign up and with actually getting the vaccine. I mean, that's a statewide thing, but I think that the Vineyard and Nantucket are really different because of our association with partners, because they don't have, their hospital is not doing it. The state is doing it on the Cape. So it's looks quite different. But they have actually, they're doing really well COVID, through the whole COVID process. It's amazing to learn how many people are actually employed by Elder Services of Cape Cod and the Islands. It's over 60 people work there. We only have Sherry, but I was also, and these are just highlights because there's a lot of information about SCOs, which is senior care options, which we don't have. There are people who are taking part in some of their programs where a family member who's caring for someone who's homebound can actually be compensated. So there are people getting involved with some of the programs that they're offering that are new, that are pretty, that I'm pleased about, because we weren't on the map for a lot of the options that come with the Elder Services of Cape Cod and the Islands packages. One other thing I'll mention is that they awarded the contracts for Meals on Wheels, and on the Cape, the cost per meal is $3.82 per meal. On the Vineyard, it's $4 and something. Here, it's $14.80 per meal for Meals on Wheels and the congregate lunch program. So, it's the same cost to the people who have the meals everywhere, but the cost to prepare and to get the meals out here is, how many times? 5 times the amount almost.
Is that because it's being made by the restaurants and the restaurants are charging us, or is it because they usually get generic foods on the other?
It's there's definitely a difference in food. Here the meals are picked up. So, all of the other places have a delivery charge, which is built into that $4 and whatever it is cents. Here, the meals are picked up and they're still high. And it's just the cost of doing business on Nantucket. I mean, there was only one person.
Huge difference though, huge.
Yeah. There was only one, there's no competition. So no one else, there weren't more than one party trying to get the contract. The hospital kitchen used to do it. And then with partners that changed. So we're just lucky that someone stepped up to the plate and did it, and it doesn't cost us anymore. But I was shocked to learn that, but, and that's it.
He's not making a big profit off this at all.
No.
No one else did bid for it, and the people are much happier with the food now than they ever were in the past.
Yeah, the food is great, and the guy who renewed the contract and actually, did the RPA or whatever. What do you call that? Request for RFP. Of course, tasted all the food, because there was more than one. There were 4 on the Cape, I think 2 on the Vineyard, and just 1 here. But he said the food on Nantucket was stunning. So, yeah. So anyway, if anyone has any questions about Elder Services that I can bring to the meetings, let me know. But it's I wish that we took advantage of more of the programs that are offered through the state. But Sherry is up to her eyeballs now. I'm sure she's not interested in, she's got enough to do. But
P.S. I love the interview that you did on Channel 18 with 2 other people, one from the Cape, and you did an interview with 2 other people on TV.
Oh, I do 2 a month.
Well, the last one you did was great.
With Jericho or with Michelle?
It was with a
Woman?
person on the Cape who has the same, two other people in the same business, and three of you were chatting about what they did in other area in the Cape, on the mainland, as opposed to Nantucket.
Oh,
It was you and two other people. It was very
She's
good.
watching-
You were-
she's
you were
watching the-
great.
oh,
She's watching the classic older episodes.
Oh, am I
to get-
watching the
to get
old stuff?
prepared for the new ones.
oh, you should see the one with Jericho. It's a spoiler alert. We don't say that we're related until the very end. Frank and Mary on Nantucket. I implore you to all watch it. But anyway,
Sounds
that's my ESCCI update.
Thank you, Allison. That was good. Great.
You're welcome.
And is there anybody else who has any questions or comments for Allison? Thank you again. I'm going to put you on every agenda now. We need to keep
Yeah.
up with what's going on. And
Yep.
thank you. for
And
doing
it's good because it just has happened, so I don't forget about it.
that. Next on the agenda was me giving an NCEA update, but Joe, since you're here, I was just going to summarize what came out of your meeting last week. Maybe you would rather do that?
Sure, I'll do that. First of all, the good news, NCA has undertaken two major renovation projects, and we've already paid a 50% deposit on each. One is to renovate the lobby so that it's more accessible for the staff and also for the people who come. And the other one is to put new flooring in, which matches what's in the great room. That's the good news. Up to this point, we're kind of sort of in a stalemate. The only thing that's been done at this point is they've removed that sliding door, so there's just an opening right there at the present time. But that will be corrected. The other thing is, as with any renovation, when you do something, you generally find out that there are other things that maybe need to have to be addressed. One of which was the men's restroom. And I'll tell you, Mary Buscarin, who's the chair of our committee, and Margot Montgomery have done yeoman work in terms of trying to get this thing organized. And really, we've received a tremendous amount of help from one of your members, Linda Williams. And I think it's going to help us to do this. The way this started is the decision of the NCA board was to begin renovation once a permit was approved. And unfortunately, it was started before the permit, so that kind of put a delay on it. The other thing is, when doing this, we found out that there was a problem with the men's restroom door in terms of swinging. And I've probably spent anywhere from a half hour to an hour pressing that button to see what happens. And the best I could figure out is that if you press the button at the bottom, the door opens. It gives time for people to get in there with a wheelchair. But 10 seconds after that door opens, it comes shut. I don't know, because I'm not an authority on that. I don't know if that's good, bad, or indifferent. But the point is, I found that if you touch the bottom of it, it works appropriately. My recommendation to our committee, though, is going to be that if this can't be corrected, and we've had people in there who installed it twice, basically, I'm going to try to get someone who is in the area that represents that company and see if it's not the installation, but the equipment itself, so that we can get that particular thing resolved. The other thing that I have to mention, and what's going to happen later this afternoon, I have a meeting with the executive committee and the committee who deals with internal, external renovations. The bad news is we are committed to the projects that are here and correcting them as they have to be corrected. On the other hand, when looking at other projects to do, such as if you've noticed the ceiling in the great room, it's stained. And it's also, some of the panels there are almost like they're falling down. They're not in any danger, but they're falling. And the discovery is that there's a problem with the roof. So essentially, what we're going to have to do is deal with the roof first before we consider anything relative to that ceiling. So these reconstruction or renovation projects are going to continue. The two that definitely will be completed are the ones I mentioned in terms of the lobby, and also in terms of doing the flooring. All of that will be done. The bad news is, and I think I should report this, The meeting this afternoon isn't to criticize what's being done or correct or make, but to determine whether or not we can proceed with other projects, such as the ceiling. The roof will definitely have to be addressed. For example, this year on our annual appeal, we received $38,022.06 received from 234 people. Last year at the same time, we received $60,593.50. This year, there were 234 donors. Last year, there were 171 donors. So there were more money came in last year from less donors than we have received this year. I think the annual amount is $162 per this year. This may have an impact on what happens in the future. We're meeting this afternoon at 4 o'clock to determine what we're going to do. The first part will be to determine what needs to be done. The second part will be what needs to be done in what order. And the third part will be obviously if we have the funds to do it. So that's all I can report at this time, other than the fact is, as soon as I know what we're going to do through our meeting this afternoon, I'll certainly send you a written analysis of what happened and where we are on that particular project. The guarantee that I can give is that the renovation of the library and certainly the restroom and other things of that nature will be addressed. Beyond that, we're really in limbo. We don't know where we're going to go from there, but we should know later today. So I appreciate you giving me a time to give the report, and I'll answer any questions you may have.
Joe, do me a favor after this meeting, give me a call about that ceiling.
I will.
And Joe, I just wanted to mention that I think all of your contributions this year are going toward renovations. And so you may not be as able as you were in the past to fund any other projects that we or anybody else might bring to you. Is that accurate?
That's a good question. And as a matter of fact, what I'll do is bring that up. It's accurate only to the extent that we have some programs that are earmarked, some funds that are earmarked for specific programs. Many of our donations come in earmarked for a particular project. So if we have, for example, donations that are earmarked for the Man and Woman of the Year, that money will be used. So it's not a matter of we're going to be necessarily taken away from something. That's a great question, and that will enter into the discussion this afternoon. That
Okay.
you can't lose sight of our commitment to the COA's projects or programs that they recommend.
Thank you. Are there any other questions or comments for Joe? Okay. I've listed any other business, anything else that anyone wants to bring up at this time before we adjourn the meeting?
Is there any federal money that Joe gets for what he does? Or is it mostly donations?
I missed the question. I think is it all from donations?
Is it all donations, the money that you use?
Most of the money we receive is from donations.
So you don't get any other financing, really? Like money?
No, we either get it from donations or we write grants for additional funds.
And do you get much money from the grants?
Well, the last grant we received was earmarked to Man and Woman of the Year, and it was I forget what it was the largest amount taken in by that Brant Point Grill breakfast that they have in the spring of any organization. I forget the figure. I don't want to give a figure because I would be wrong, but it was in 5 figures.
So how about places like Remain, who are always looking for places to help Nantucket? Or I'm trying to think that other group.
I'm not sure I understand.
Well, doesn't Remain give donations to or money to different groups that are in need?
Well, I think the connection with other groups, is what was mentioned by Marianne earlier, and this food, and Laura, this food program.
Yeah.
We're involved in that, where the food is being prepared.
Yeah.
The money we get billed, and a grant pays for that bill. So we're like the conduit for paying for the expenses of the food that's being prepared. So that we get involved in that, but that doesn't affect our budget because we're just a pass-through for the funds. In other words, if they,
Gotcha.
I think the last bill was maybe, I forget what it was, but whatever the bill was, we were billed, we submit we pay the bill, and then this foundation or the fund that they have pays us back. So it's just a transfer of funds.
Gotcha.
But that's earmarked for that program. We can't use that for any other program other than that. In other words, we can't say, once you give us the money, we're gonna do something else. The money is always there for programming.
Right.
I mean, oftentimes if you approach Remain or the Community Foundation with an idea that you need financing for, it could, they could reimburse, or it would have to be run through a 501c3, which is what the NCEA is. So if there was a
Right.
project that you thought of that it would be, you needed seed money, you could look on the various websites and see if one of their lending programs or one of their grant programs fit the description of what you wanted to do. And then the application would go through the NCEA to the Community Foundation. And if you want it, then they would be the funders. So that's what the NCEA does for the Council on Aging, is there our nonprofit side. So
Well, if you recall, a few years ago, we received a grant. When I said we write grants, we received a grant, I think it was from the Community Foundation, to do an aging survey of Nantucket. And many of the programs that have come out, either provided by you or provided by us, actually came from that money. We used that. From that report, we were able to do programs after our programs, and to also support some of the things. The study is still available. Everybody has a copy of it, I guess, or I can get a copy of it. But we do write grants. Those are the two most significant grants. I think of all the grants that we've received, the only one that was turned down, or all the requests we made, the only one that was turned down was for the garden. We applied to the Garden Club to redo the garden in front of the salt marsh, and that was turned down. But mostly, we've been very successful in our grants. We try not to be piggy. The one from the Grant Point Grill, we didn't, after receiving it one year, we didn't apply the next year, figuring other nonprofits could have used that. But that doesn't mean we won't reapply once we get back in business.
Thank you
Okay.
for that.
Any other,
me,
Allison?
so I'm wondering if we want to do outreach potentially through the Interfaith Council for new members for the Salt Marsh. I mean, I haven't filled my application out yet, but I'm going to. But I have friends that are 70 that would, ask me about what the programs are and, oh, do they have singing? So I just am wondering how we can, get new blood into the Salt Marsh, people that don't know enough about it, or, are just now starting to realize that they want to be a senior citizen instead of not. So
How about Daybreak? Have Bill write a little story.
yeah, but is that something that we want to do? I mean, we don't have a center. It's not open. What do you guys think?
Well, he could write something that basically talks about going, Daybreak can tell him all these things that are online that nobody knows about.
The other thing is the Inky Mirror was interested in covering seniors. So perhaps they'd like to do an updated story about the Salt Marsh and its available programs during COVID, which are still going very strong. But, it really is an individual basis, because if somebody does not know about it, but they express an interest, a phone call to Laura would probably make them a decider one way or the other, because Laura is a great salesperson for the Salt Marsh. She is.
That's absolutely true.
And
That's
just
absolutely
one
true.
conversation with her would help them decide if there's a program there they want to participate in. And that's what it's all about. Is there one program that gets them in the door and then maybe they'll sign up for other things? And Allison, why are you dragging your feet?
Because it's not an electronic form. If it was a fillable form, I would have filled it out and emailed it back instantly, but I got to print it out, blah, blah, blah. And then I haven't heard back from Lizzie Congdon at the Artist Association yet, but let's put that on the next month's agenda, is if she can tailor, what I said to her was that people might not think that they were artists. So to call something an art class might not be the right thing, but to have a craft class or to have something like that you make instead of expect that you're going to make an original piece of art might be an easier way to get people involved. And then, it could be like the children's programs that they have. They have, if you don't have the materials, you can pick up materials or have them delivered if you're homebound, so that you can participate with a particular class. So I'll re-up with her. Someone else said, oh, do they have singing classes? That might be interesting to have a Zoom singing class.
Well, Paul Connors does have a singing class. There's a
Right.
sing along with Paul Connors.
Oh, that's right. Okay, well,
Allison,
I don't know, Laura, are you still on? Well, she's
I
not.
am, I'm here.
But when Paul Connors does his thing, he has sing-alongs, right?
He
Yes.
did a Name That Tune last month, which went very well. This month, he's going to do love songs. And actually, the program coordinator at OIH signed up for it. So they can Zoom that down at OIH. So
oh, great.
yeah, so she was thrilled about that. And I'm sure he'll do some, St. Patrick's Day next month. He loves it and he changes it up. Sometimes he sings, sometimes it's everybody, sometimes it was Name That Tune. So there you have it.
Do you think that the Inquirer Mirror, Laura, when you do your upcoming programs and activities, I'm always amazed at what you have done the previous month and what's going on. Could we do something maybe in the INM once a month of all the upcoming programs and activities?
You'd have to ask them. They, at one point, I don't, they used to put in the congregate lunch, what that was.
Right.
And then I think, Allison, didn't you want to do some sort of write-up once a month about seniors or have seniors talk about something? And
I don't think I signed up for that. Jude?
no, you just thought that would be a good idea.
Yeah. Jude?
well, two things. One, that I think I approached the newspaper and I forget
Oh, okay.
after that, but they said if you write it up and submit it, they will look into putting it somewhere, possibly. That could be one thing. Just write up the programs and send it in, and they respond. Put it in.
Josh Balling does get my newsletter. Just so does Bill Farrell. And, they put in what they have space for, or, what's interesting to them, or.
Well, Allison, another thing I wanted to mention on your crafts, Nantucket Reuse, Emma Young's new shop
Yeah.
is overloaded apparently with stuff. Maybe she would be someone to contact.
Yeah, maybe she could put kits together. Yeah.
For seniors, or for every so often, for even if
Maybe
we
she'd do the program.
borrow some funds and pay her a little bit for it, but she's so into making this.
Yeah. What's that noise in the background?
Somebody has to go on mute.
Somebody has a dog.
It's more than a dog. It's something else.
Oh, they're there. I actually so Emma is also going to be taking things, clothing items that to save the landfill. Did you see that anywhere?
What?
Yeah, she's going to be taking donations that will be shipped to the Salvation Army off island. She's taking donations of used, clothes and belts and stuff that that the thrift store won't take.
Who is this?
And- Pardon?
Who is this person?
Emma Young.
Where do you drop this stuff off?
She has a place on Hannaby Lane.
Where?
The very last unit on the left as you pull into the parking lot.
Well, there is no parking lot. Hannaby Lane's behind,
Oh, well, whatever that Tomahawk, no, not Tomahawk.
that's Candlewick is the whole little subdivision.
Yeah, Candlewick then, it's the very last shop on the left. I actually have some stuff that I'm going to drop off from the thrift store. So I'll talk with her about working with seniors. I think she likes seniors too. And then one other thing that we should think about, when are the terms up and who's leaving the board? I know Kendra bought a house off island and moved last weekend.
She's still on the board. She's going to stay until the end of her term.
Well, she's not here
And
today.
The Vanessa Larrabee is up 2021. Judith Perkins is up 2021. Linda Williams is up 2021.
No, I don't think so. I was reappointed like last year or the year before that. I got a 3-year term.
When am
Okay.
I up? I thought I was up.
This
This is what-
information is on the website, on the town website.
Yeah, and the website has been
The
wrong
Council
on
Aging,
everything.
It's all listed there.
I'm going to
All
check because the website's been wrong on just about all of these.
All right, well, this is
I'm
what
just-
was given to me when I took over as secretary. So, yes,
I'm-
3 for 2021, Vanessa, Jude, and Linda.
I think that we should find out who who's re-upping and look for people who can be committed and work with us, because there's a lot of work. We got the senior center in our island home, although not at the next town meeting. I mean, we should all be on top of all of that information, and be spokespeople for seniors. So we need committed people to join us.
And I'd like to say that I think we are committed people now. It's
Yeah.
really good to see that we can get a quorum for every meeting these days. And I really appreciate that everybody's committed to being here, even though it's on Zoom, which is not the same as being together in a room for sure.
Yeah.
Thank you, everybody, for your commitment. I hesitate to try to get more members now while we're Zooming, because I think it's not very satisfying if you're coming in the middle of Zoom. So that's the reason why I hesitate asking people to be on the board, even if I mention it.
Who do you talk to about potential place?
You're muted. Susie, you're muted.
Her phone was ringing.
Who do we send properties that we think might be potential spots for the future location for Salt Marsh?
Maybe.
Went over this the last meeting.
The NCEA? No, there's a building. Julie Fitzgerald is the committee chair of that quest, right?
Yes.
We talked about, we did talk about Sherburne, we talked about Cassidy's, and we talked about if they build a new thing for the island home that we'd move in, that would be a great place for us to move in there. So this has been beat up already.
But Cassidy's is gone.
Yeah, so we've already talked about this. And
If
so
you
they're,
have
I don't know where they're going now.
Well, Linda, you've talked about it, but I'm asking the question, who do I speak to?
Julie Fitzgerald is the right.
Okay,
person,
thank you.
and she's on the NCEA.
I have a question. If we're up this year, when? How do I find
Generally
out?
speaking, they let you know they send out a letter to those people who are on the committee to see if you want to re-up, and you sign the thing and send it back.
Okay.
Generally that occurs sometime at the end of April, because they start the interviews in like May and June. They're like 2 sets of it. So you won't see anything for a couple of months probably.
Thank you.
It would be great to keep everybody who's on the council, on the council now, because it's a really good group of people with lots of ideas and energy. With that, I'd also like to thank everybody who contributed today, because it was a lot of good information. And can I get someone to make a motion to adjourn the meeting?
So moved.
A second?
I'll second it.
Second. Second.
Okay, and I'll go down the list. Please say yay or no. Allison,
Yay.
Diane,
Yes.
Jude,
Yes.
Susie,
Yes.
Linda?
Yep.
Marianne, yes. Thank you, everybody, again.
Nice to see you.
All right, I already sent Laura the questionnaire. So Laura, send that out to everybody so we can start thinking about any changes that we want to make. Okay,
Okay.
thanks.
Thank you very much, everyone. Have a nice day.
Bye.
Thanks, Jericho.
Thank you,
Being-
Jericho.
Also, very sorry about the late start, guys. Sorry about that.
I reminded you
Shouldn't
this
happen-
morning.
shouldn't happen again. Just we ironed that one out.
No, no biggie.
Thank
Thank
you
you.
very much, guys. Bye-bye.